Have you ever looked at a new mom and thought, she's probably just tired, but she's actually really struggling? I'm going to say something clearly right from the start. We normalize too much suffering in new motherhood. We brush off things that deserve attention, and too many moms end up silently convincing themselves that what they're feeling is just part of having a baby. I'm Catherine O'Brien. I'm a licensed marriage and family therapist in Sacramento, California, and I work with moms, couples, and families in this season all the time. And one of the questions that comes up over and over is this: how do I know if this is baby blues or if this is postpartum depression? Because in the beginning, it can feel really confusing. You've just had a baby, you're sleep deprived, your hormones are shifting, everything feels upside down. So of course, there may be crying, of course there may be overwhelm, of course there may be emotion. But here's where the confusion gets expensive. When a mom keeps telling herself this is probably normal, even as things are getting heavier, darker, or more isolating. And the stakes are high here because when postpartum depression gets minimized, moms often wait. They suffer longer than they need to, and they pull away from support. Partners do not always know what they're looking at, and everybody starts adjusting around the pain instead of getting help. So in this video, I want to help you understand the difference between baby blues and postpartum depression, what signs I pay attention to clinically, and what this can actually look like in real life, and what to do if you're worried about yourself or someone you love. Baby blues are very common and usually show up in the first few days after birth, and then ease within about 2 weeks. Postpartum depression is heavier, it's longer lasting, and it can interfere with bonding, with sleep, and just overall daily functioning. Perinatal mood and anxiety disorders are also common, with studies suggesting about 1 in 5 women experiencing depression or anxiety during pregnancy or postpartum. So let's slow this down. Baby blues are real. They're not fake. They're not a weakness. They're not a sign of someone is doing something wrong. A mom with baby blues may feel weepy, emotional, raw, overwhelmed, more anxious, more sensitive, maybe crying more easily than usual. She may say, I don't even know why I'm crying, and then later feel a little more like herself. That roller coaster can be part of the early postpartum adjustment period. But when I'm thinking about postpartum depression, I'm looking for something heavier and more persistent. I'm looking at whether she feels upset most of the time and not just in waves. I'm looking at whether she is withdrawing, whether bonding feels hard, whether she feels numb or angry or hopeless, whether her guilt is getting really loud, and whether she's not sleeping even if she has the chance, and whether she keeps saying, I don't feel like myself. And I really want to say this part because a lot of moms miss it. Postpartum depression does not always look like sobbing sadness. Sometimes it looks like irritability, sometimes it looks like rage, sometimes it looks like numbness, and sometimes it looks like going through the motions and smiling when people come over, but falling apart inside. And sometimes it looks like being very high functioning on the outside and deeply disconnected on the inside. And that is why this gets missed so often, because culturally we still have such a narrow picture of what struggling is supposed to look like. And when we miss it, moms often blame themselves. They say things like, I wanted this baby, so why am I feeling like this? Or maybe I'm just bad at this. Maybe everybody feels this way and I just can't handle it. I should be grateful. I should be happier. That shame can keep women quiet for way too long, and the longer someone keeps trying to outlast something that actually needs support, the more isolated she often becomes. That is also why I want partners listening to this video too, because sometimes the partner sees the change before the mom can name it. And sometimes the partner is the one thinking, she doesn't seem like herself, but they do not know whether they are overreacting. You're not overreacting for paying attention. And let me give you a couple examples based on patterns I've seen in my own work. One mom I'm thinking of was about 4 weeks postpartum, and she kept telling herself it was just the baby blues. She thought, I'm emotional, I'm tired, this is probably normal, but what was happening was bigger than that. She was crying a lot, she was angry a lot, she was isolating with the baby and pulling away from her partner. And even when she had opportunities to sleep, her body and her mind would not settle. And this is a really important clue, because baby blues usually do not keep deepening like that after those first couple of weeks, usually the first 2 weeks. And when things are still intense at 4 weeks postpartum and affecting sleep, connection, and daily life, I start thinking much more seriously about postpartum depression or another mood or anxiety disorder. Another mom was about 4 months postpartum, and what she kept saying was, I think this is just normal new mom. Her partner kept noticing that she never really seemed like herself again after the baby was born. She was more withdrawn, less connected, more shut down. She was not having one hard day here and there. She was living in this diminished down version of herself. And that matters because postpartum depression does not always show up right away. Symptoms can sometimes emerge later too, even months after birth. The CDC research found depressive symptoms can still show up at 9 to 10 months postpartum, and more than half of those women had not reported symptoms earlier at 2 to 6 months. Those are the moments where I really want people to stop minimizing what they are seeing, because normal new mom stress does not usually make someone disappear from herself. So if you're wondering, okay, but how do I actually tell the difference? Let me make this as clear and practical as possible. I want to give you a few questions I would want any mom or any partner to think about. First, is it easing with time or is it getting heavier? Baby blues tend to be intense but temporary, and postpartum depression tends to linger, deepen, or keep affecting more parts of life. Second, is this mostly emotional sensitivity or does she seem unlike herself? There is a difference between I'm crying more easily this week and I feel lost, numb, angry, disconnected, and I don't know where I went. Third, is it affecting bonding, functioning, or connection? If it is getting hard to bond with the baby, hard to accept support, hard to connect with your partner, hard to rest, or hard to feel any relief at all, that matters. And fourth, is guilt running the show? A lot of moms with postpartum depression are not just sad, they are ashamed. They are judging themselves every second, and they are narrating their whole experience through failure. And fifth, would I tell a friend to get support if she described this to me? Sometimes moms can recognize it more easily in someone else than in themselves. If a friend said, I'm crying constantly, I'm angry all the time, I'm withdrawing, I don't feel like myself, and I'm not sleeping, even when I could, you would not just say, wait it out. You would say, hey, I think you deserve support. And that is what I want moms to start offering themselves to. And if you're a partner watching this, here's what I want you to know. You do not need to diagnose anything. You do not need the perfect words. Do you want to pay attention to changes that are persistent? If she seems more withdrawn, more hopeless, more irritable, more unlike herself, do not minimize it. Please do not say, you're okay, this is just normal, you just need more sleep. Even if sleep is part of it, those responses can land as dismissive. Try something more like, I've noticed you don't seem like yourself lately. Or, I'm really glad you told me. You do not have to carry this alone. Can I help you make an appointment? Can I take something off of your plate today? That kind of response lowers shame instead of adding to it. And I also want to say that partners can struggle in the postpartum period too. Studies cited by Postpartum Support International suggest that 1 in 10 dads may experience depression and anxiety during the perinatal period. So what do you do if you think it may be more than baby blues? Reach out. Talk to your OB. Talk to your primary care provider. Talk to a therapist. Ask for a medication consultant if needed. Tell someone the truth about how bad it has been. Please do not wait until you barely functioning. You do not have to earn help by getting worse first. Postpartum depression is treatable, and getting help sooner can make a real difference. And if this video is helping you put words to what has been happening, save it, send it to a partner, or share it with a mom who may need it. Sometimes what helps first is not some perfect solution. Sometimes it's just finally having language for what is going on. If there's one thing I want every mom to hear, it is this. Just because baby blues are common does not mean ongoing suffering should be brushed off. You are not weak if this feels harder than you thought it would. You are not failing if you need support, and you are not a bad mom if you do not feel okay. And you do not need to wait until it becomes a crisis to ask for help. And if that little voice in you is this feels like more than just adjustment, I really want you to listen to that voice. And if you're the partner, friend, or family member of someone who is struggling, trust what you are noticing too. Support early, say a thing, open the conversation, help reduce the shame. That can change so much. And if you're wondering what to actually say to a mom who is struggling, watch this next video right on how to talk to a mom who's struggling. This is an oldie but a goodie that I made years ago. Check it out, because sometimes people really do care. They just don't know what to say.